Now the bill faces a bit of a new challenge, and that is getting Senate approval for those fixes that we heard so much about that were approved by the House right after that main bill was passed. My next guest says that he is disappointed by passage of this bill, and he says that the bill will hit future generations, quote, very hard. He is Republican Senator Bob Corker. He is on the Senate Banking Committee, and we are really pleased to have him with us today. Welcome, Senator. Good to see you again.
Martha, good to be with you.
All right, I'm holding here, this is a 153-page document. This is the fixes that's going to the Senate. Tell everybody out there what they need to know about this and whether or not this is going to be a benefit for people like you who are disappointed in this bill.
Not really. I mean, the president has a bill in his pocket, and regardless of the outcome of this reconciliation package, you know, the health care bill that came out of the Senate on Christmas Eve becomes law. So there are some fixes in this reconciliation bill, but the big issues are not fixed, and that is the charade that's been really placed on the American people accounting-wise. I think that's the piece. Look, there are a lot of reforms in health care that all of us agree to, and I think about when the president came into office, there was bipartisanship as it relates to this issue, but the accounting and the types of things that are going to be placed on future generations, to me, are horrendous. Our governor, who's a Democrat, called me Friday and let me know that this was going to add $1.1 billion in stress to our state's budget at a time when it's already under tremendous stress. So the accounting piece of it cannot be fixed, and that's very problematic.
You know, I think a lot of people wake up this morning, they look at some of the immediate benefits according to the bill, and that is that, you know, your young people in your family under the age of 26, they can stay under your plan, a good thing. Children immediately will not be denied because of pre-existing conditions. But all of these things, as you point out, come at a large cost, and really it falls on the backs of two areas as I see it, and you tell me if I'm wrong. One is the states. A lot of this is going to be paid for by the states, and you just pointed out $1.1 billion for Tennessee. And the other is higher income earners, correct? Those are the two places that all this money is going to come from.
Well, that's correct. But then if you look at the double counting that's taking place with Medicare, if you look at before the ink dries, there's going to be a $200 billion bill passed to make sure that physicians who treat Medicare recipients don't have a 21% cut. So the fact that they are saying that this is something that reduces the deficit is just a charade. And I think, regardless of which side of the aisle you're on, we need greater integrity here as it relates to communicating with the American people. It's future generations. It's the young people that in many cases haven't even been born yet that are going to be paying the brunt of this. And I'm so discouraged about that piece of this bill. That's the part that is really going to wreak havoc on our country.
You know, one of the things that I find particularly interesting about you, Senator, is that you built a business. You started a construction business, and when you address these issues, and we hear you talk about them in these forums, it often comes from that background, you know, of having employed a whole lot of people and run a business every day. According to this, it says that, you know, small businesses can deduct as much as 50% of their health benefits for tax purposes in 09 and 10, excuse me. Isn't that a good thing for small businesses?
Well, look, in any piece of legislation like this, there are some good things in the bill. And no doubt in this bill, there are some good things. I just wish that we had been more honest about the cost. I wish that we had continued that bipartisan effort that took place prior to the president coming into office. You know, bipartisanship means, in the Senate, for instance, maybe getting an 80-vote bill, not something that just passes down party line. And so, look, this bill has taken a big turn for the bad. Now what we'll do over the next several years is I will tell you that I think both parties will be joined at the hip trying to fix the many problems that this bill has created.
Senator, thank you so much. I'm sorry to say that we ran out of time, because I hope you'll come back and talk to me about the financial regulations that I know you're working on as well.
Thank you.
We hope to do that soon. Senator Bob Corker from Tennessee.